Okay, looks like we're live here. So thank you everybody who joined. If you don't know who I am, I'm Nathan Peterson. I'm a licensed clinical social worker. I'm here in Texas. I specialize in OCD, anxiety, tics and Tourette's, and BFRBs, like hair pulling, skin picking. I do these videos pretty frequently, just like live question and answers with individuals. And I'm here with Stuart Ralph, who's has the podcast, the OCD Stories. And if you haven't heard of this podcast yet, I'd be pretty surprised because it's pretty major. I'm so fortunate, so happy that Stuart was able to join us and be willing to take time out of his life to be here. And so, Stuart, instead of me kind of saying who you are and everything, what would you like to say about yourself? Introduce yourself.
Yeah, thanks for inviting me, Nathan. I really appreciate it. So, as you say, I run the OCD Stories podcast, which I've been doing for, I lose count, maybe nearly 6 years, I think. But yeah, I interview therapists, researchers, people with OCD to get them to share their story. I try and sort of get out of the way and especially when it's someone sharing their story, just kind of share it as much as possible. And then more recently, I'm now a child and adolescent counsellor and psychotherapist here in the UK. I do see clients with OCD, although I kind of see many varying difficulties, and so I like to get that variety, especially when all my advocacy is in OCD.
Mm-hmm. Yeah. It's amazing. So you do therapy yourself, and as well as do this podcast, which I think is weekly.
It is, every Sunday.
Yeah. So it's pretty amazing. As talking to Stuart before we got on, I'd love to see the face that goes with the voice that I've been hearing for the past few years, and so.
Yeah, I like to keep my face private.
Which makes it so wonderful that you're here.
Thank you.
And so, well, if you haven't been here before, typically you kind of ask your question in the comments here. If you can, you try to keep your comment into one big thing instead of a bunch of different ones, because it's hard to see and they might get jumbled in the mix. And so what we're going to do is pull up some questions, throw them up here on the screen, and try to answer them the best that we can for what you're going through. And so it looks like more people are shuffling in, and we've already got some questions. So I'm just going to get started, if that works for you, Stuart.
Yeah, go for it.
Okay. Let me just find one real quick. So here's one that I saw from Alexandra. And can you talk about false memory OCD and the need to confess about false memories? Confessing definitely helps, but it's crazy talking to others about memories that never happened or could be dreams. False memory OCD, for me, when I talk to people who struggle with this, like that's a really, really, really tough one. Because the brain constantly wants to keep going back to see if it's real or if it's not real, looking for that evidence. And at least when I see people confess their false memory or their story, in my experience, they want to see how's that person going to react once I tell them this story. If they don't scream and run out the room or say, I got to call the police right now, then you know that like, oh, I'm good with this thing.
It's the reassurance, isn't it?
Yeah.
Yeah.
And so pretty common for people to want to confess that. And often people don't know they're doing a compulsion when they're actually confessing. And so I don't know if you have any thoughts on this, Stuart.
Yeah, I think that was a really good answer. And I think it always reminds me similar of like real event OCD, which can be loosely based on something that happened, but the brain's taken it out of context and overthinking it. And this is a little different in that it most likely didn't happen. It's entirely false, as the name suggests. But I guess on this one, just as you said, being aware of the confessing, if that is the primary compulsion, and also in terms of rumination, like what's going on in Alexiana's head or anyone else, I can imagine the thinking over and over and over and again, trying to figure out, well, is this memory real? Isn't it real? And that's a compulsion too. And just being mindful and trying to slowly cut them down, even if it's scary. The compulsions there.
Yeah, that's a great answer. It's typically rumination tends to be a big compulsion with this, just thinking about it, trying to problem solve and know for sure. And as we know, we use exposure and response prevention to allow the brain to actually be more uncertain about these things. And so it's to not know if that memory was true or if it was false. It's actually to say, I'm okay not knowing what it is, which is such a sometimes horrible answer, but tends to be the answer that we give is, we choose to not know and live life in the present the best that we can.
Yeah, I agree. Yeah, and I guess shameful plug for my podcast is this Sunday. I was editing the episode today. The psychologist that's coming on, she gives some really good examples around memory, and the more we kind of look at it, the less we believe it, and then that's the problem. So maybe that'd be worth checking out for Alexiana.
I love that. That's amazing. So, all right, let me find another one here. We've got Jamie here. It says, I'm 30 years old. I just diagnosed with OCD. Only my husband knows. Is it recommended to tell others, such as parents? If so, how detailed? I deal with unwanted sexually intrusive thoughts. Thank you. I don't know about you, Stuart, but I kind of say each person is kind of their own individual self.
Yeah.
And I think it's great that your husband knows. It's something that people have to feel really comfortable talking about these thoughts, and especially when it comes to like sexually intrusive thoughts, because sometimes the world doesn't understand really what this is all about. We've even seen this recently through different companies and different accounts kind of presenting some false information on this stuff. And so recommended to tell other people, like, I think it's all personally based off of what you feel like is beneficial for you. Some people might tell somebody else because they want to gain their support. Others might just feel like it brings them power to share their story with somebody else. And really, whether it's sexually intrusive thoughts or it's other types of OCD, we kind of just say like OCD is OCD. And so sometimes details don't really matter other than my body's making me feel a certain way. I'm having all these intrusive thoughts and it wants me to figure it all out or to make sure I'm okay. I usually say maybe even explain what OCD is to the person more than you specifically kind of going through what you're going through. But I could see how personable or vulnerable it is to talk about something like that.
Yeah, I fully agree. I think, like you said, you don't need to give the explicit details that it's sexual intrusive thoughts. It could literally just be, I have these really troubling thoughts. You could even say they're taboo in nature, and you don't need to go any more specific than that. You can do, obviously, if you feel safe. And I think for me, the other thing that comes up is, and you did talk about it, but what's the reason for sharing with one's parents or anyone else for that matter? Is it actually I'm really close to my parents and I want them to know? Then that's cool. Is it actually my parents reassure me sometimes, or they enable my compulsions and I need to tell them so they can stop? So I guess that's what comes up for me is in my own personal journey. I've only told people when I've felt I've needed to, or there's a benefit to me in telling them. But like you said, it's absolutely a personal choice, and it's going to depend and differ for each person.
Yeah, wonderfully said.
Right.
Like that. And so Jamie had a few other questions on here. So she purchased the course. It's tremendous. I really appreciate that, Jamie. Thank you so much.
Nice.
So I'm going to kind of move to some others because I know we've got a lot of different questions here, but I created an exposure hierarchy specifically for contamination. And I was wondering how detailed the hierarchy should be. I know each therapist is different on maybe how they do things. I know for me, how I structure my hierarchies is I say, let's pick an action that we're going to do, something that you can repeat over and over and over and over again. So it could be, my action is to pick this up and I'm going to rub it across my fingers. That's my action. And then I say, let's pick a statement or a way you're going to respond differently to it. I'm going to respond differently by saying, maybe this will get me sick, maybe it won't. It tends to take the threat or the worry and how can I respond completely different to that? And then what are all the compulsions I'm going to avoid doing while I'm practicing this? So I'm not going to hold it like this. I'm not going to like avoid. I'm not going to wash my hands directly after. Here's all the things I'm going to practice not doing. And then I usually say, what's my homework? How am I going to practice it? I'm going to do it 5 times a day, or I'm going to do it 20 times a day, or 3 hours a day, whatever is realistic. That's how I do my hierarchies, like detailed wise. And I say, let's just keep going with this exposure until it either just doesn't really bother you very much, or you feel pretty confident that you can move to the next step and you could always revisit this old one and it doesn't really do much for you. And so, but some people just say, I'm just going to grab this thing and that's how, as far as I go with how detailed my hierarchy is, as long as I don't do a compulsion. And so for you, Stuart, is there a way that you kind of build a hierarchy?
It differs, but I think for me it's like start simple. So one idea is maybe like think what's the 10 out of 10 anxiety if we stick to SUDS, what is that thing? Write that down. And then what's a 2 or 3, what's something I could fairly easily do, but it would just cause me a bit of anxiety. And maybe you do the couple other steps after that. And then don't worry about everything else in between. Once you've done those first few things, then think what's the next few things that would push me, and like build up. That's more my laziness coming in as opposed to having to really think about everything that would go on it and just start small and then think what's next, But yeah, I think it's going to differ for each person again. Some people want that rigid, like, here's the 100 things I need to do sort of thing.
I don't know about you, Stuart, but I've kind of learned over time. I used to be like, okay, well, we're going to touch this thing and then we're going to move up to just something a little bit bigger and something a little bit bigger. And then I kind of found over time that like people would get to that step 10 or keep thinking about it. I don't want to do that step 10 thing. And what I found is that each person's different on, we gradually move up to something harder, or we just say, I'm going to do this thing, and then I'm going to touch this thing, and then I'm going to touch this door handle. And it doesn't matter what order I do it in, as long as I can continually respond differently to that. And each person's different on how they might respond to that. But it kind of teaches the brain that there isn't one thing that's harder than another. And sometimes that's really important for the brain to learn.
Yeah, I like that about removing the 10 out of 10 thing, because it keeps you motivated as well. And then because there's nothing above your head. It's just, I've done this one thing, great, what's next? Do that, great. And you're constantly succeeding, and there's not this big dragon that you're going to get to in 8 months' time that you need to slay, that's been terrifying you this whole time.
I love that. Well, great. Let's go. How to best motivate myself in ERP. I've been meeting with my therapist for almost 5 months, and I'm still struggling with that. This is a really good question. When we go to these international conferences, they have whole sections based off of like motivation. How do we get a patient or a client to be motivated in treatment? It's such an important thing. And it's so absolutely difficult. For me, I try to build a foundation for the person of what is it worth for you to face fears, essentially, to touch this thing that you don't want to touch, or to not know your past, or whatever it could be. It's having to know, what is that worth for me? Maybe what I've gained, what I've lost from my OCD, and knowing that when times are really tough, what's going to get me to continue using exposures. Because compulsions are much easier to use, but can have that detrimental effect long term. So to motivate, I usually start with that foundation. And sometimes it's just getting teeny little wins here and there. What can I do that is just one thing that is different about my day, one compulsion I'm willing to not do, and practice responding differently. For my brain to learn to like, hey, everything was all right. I didn't die, it was perfectly fine. And the only way it knows that is because you responded differently. That tends to build motivation, like, I want that experience again, and I want it again. And having a detailed plan sometimes can help if you don't have that. And so, have you found a trick or a way to motivate?
I think it's individual. Like, I like the small wins idea. Absolutely, momentum is everything. Well, not everything. It's a big thing. And what was I going to say? A big one for me that came to mind was just peer support, in the sense of, like, you know, like NoCD have free groups. OCDpeers.com do support groups, and I'm sure, I would predict one of those sites has a support group specifically for this question of, like, motivation in ERP or whatever it is. If not, just join in one of those groups and bringing it up, and you'll meet probably 5 others who are like, yeah, you know, some months I struggle, or whatever it is. Yeah. And what was I going to say on that? I think sometimes, I know the core fear for some people and some therapists is like, doesn't exist, shouldn't talk about it. But sometimes I wonder, when people are really stuck, and like, is there something else getting in the way, you know? So as a therapist, I would want to explore that, and the beliefs around doing ERP, and whether the person thinks it's dangerous or not, or, you know, if there's how they view anxiety. Is Abramovich said on my podcast, you know, anxiety is safe and tolerable. It's never killed anyone, as far as we know. No certainty. Yeah, so I think those are a few things, but like you said, it's the small wins. If where you're currently at is really hard, try and find something even easier, you know, or smaller, or whatever it is, and just keep going down until you find something that you can do, and then build from there. There's no shame in that.
Oh, absolutely. And there isn't a timeline either. That
Exactly.
I've been in this for 5 months, and I should be a lot further. That it's like everyone's in their own pace, and people focus on themselves. What can I do differently today that is maybe different than I did yesterday?
Yeah.
And that definitely builds that momentum. I like that you said that.
Yeah, one other thing just to add on that, actually. So Catherine Benfield, who's a UK OCD advocate, who's been on my show a couple of times, the first time she came on, she shared the story. So she was having postnatal or postpartum intrusive thoughts around harming her child and stuff. And by the time she got treatment, her belief of herself that she was this bad person, you know, because she was having all these thoughts about her kid. And she had to do months of like compassion-based work before she was able to do the ERP, because she thought she didn't deserve to get better and to do the ERP. So that's another way, you know, what else can be done before ERP to shift anything that's stopping Leah or anyone else. Yeah, so I just thought I'd share that.
I'm so glad that you brought that up, because we tend to go into treatment saying, you know, we know it's the gold standard treatment that we do, but what else is that roadblock right before you do it?
Yeah.
So, yeah, I love that you did that.
Thank you.
Said that. Olivia says, my compulsions double when I have stress. Is that normal? I experience from people that I see, seems like compulsions tend to happen a little bit more when people are stressed, when they're anxious, when life is a little bit more out of control than normal. Because they're looking, the body says, well, if you do these compulsions, then you'll have a little more certainty on what's going on around you. Obviously, I'm not a scientist. I don't know for sure if that is a huge correlation, but just kind of seeing individuals that come through, come to my office, that tends to be the case for a lot.
Absolutely.
Yeah.
Yeah.
Got Laura. Are there strategies that can aid in the management of anxiety experienced while working on exposure and response prevention? What do you think?
Yeah, I'm just trying to read it. So, other strategies that can aid the management of anxiety. So, am I reading this as sort of coping and managing anxiety while doing ERP? Is that how you read that?
I think that's how I read it.
Yeah. I don't know. I struggle with the word management, and there's nothing wrong with that. I just think the management implies controlling, and as soon as we try and control anxiety or intrusive thoughts, we get more of it. So maybe it's more around strategies of like accepting or making space for anxiety while doing ERP. That maybe fits with me more better as a therapist, or especially if you think about acceptance and commitment therapy of making, we're all humans, we all have difficult emotions. It's about making space for those, and there's the act metaphor of the unwanted party guest. You're having a party and the jerk at the door, I think it's called, the jerk shows up at the door and you don't want to let the jerk in because you don't like them, they're going to annoy you. But if you spend your whole time at the door trying to stop this jerk from getting in, you're missing out on the party, and you're annoyed because this jerk's at the door. When if you just let the jerk in, let them go around probably bothering other people, and then just go about enjoying your guests and the party, you'll probably forget that the jerk's even in the party, I don't know if I explained that well, but for me it's just, and Rumi, the poet he's got a poem around allowing depression, sadness, everything else, anxiety in at the table, and they're just guests and they'll leave on their own time. And I feel some stuff around that, around accepting anxiety as a normal human experience while doing ERP. And I guess also accepting that while you do ERP, you're probably going to have more anxiety, at least in the short term, but it will hopefully in time diminish.
Yeah. I kind of the same with the same thing that you said is when we're doing exposures, we tend to embrace that anxiety. For me, I don't focus on the anxiety very much during exposures, that it's just there. And if we're trying to control it, trying to get it to go down, then we're kind of doing the wrong approach with exposures. We don't actually even need anxiety. It's going to be there. But we kind of just say, each person does their own thing, whether it's like putting my arm around the anxiety, it's going to be my buddy, and it can go if it wants to, it can stay if it wants to, but either way, I'm embracing this thing and I'm not doing anything to remove it or to get it to go away. That's kind of a way to,
I like that.
When people are doing those exposures, is my anxiety might go down, it might not, but that's not the idea. That's not what I'm going for. I'm going for maybe retraining my brain to know that it's possibly sending a false signal, and I'm willing to risk that regardless of the anxiety.
So you go the more inhibitory learning route, right, versus habituation.
I used to do habituation. That's all I did. And I realized people would get to a point almost every time where they'd start saying, well, why is my anxiety not going down? Why am I still feeling anxious? When will this ever go away? And then that would turn into its own thing for us to work on. That for me, it's hard to ignore anxiety, obviously, but I tend to teach people that it doesn't matter if you're feeling it or not. Obviously, it matters to you because you're feeling it, but we're not going to give it much value. And it's really hard to do. Easy to say, it's hard to do.
Yeah. So I think it's a good question. I think maybe it's what we've said, but then also like some compassion around, I'm feeling a lot of anxiety while I'm doing ERP, and just some of that more self-compassion for yourself, Laura, and anyone else for maybe increased anxiety at any point, and that's how we tolerate it, I guess.
Right. Love that. All right. Taking a chance on this question here. One important question that no one can explain. How and why does viewing an HOCD triggering video cause unwanted physical arousal? So that's a good question. I know that I don't know the physiology of our whole body, why it does what it does, but I know that when somebody doesn't want something to happen and they're checking to make sure arousal doesn't happen, it's most likely going to happen because they're checking if I watch this video, is it going to make me feel aroused? And they're checking, and that in itself is bringing that awareness to something that they don't want in the first place. And so they're going to notice something that maybe, even if they're not aroused, they might feel aroused. And just the idea of sex, for example, just having that in the air, thoughts of it, we just know it doesn't matter what gender, what people are thinking about. People can be aroused by anything, but that's not a reassurance kind of answer, but more of we try not to put much value to it. That I watch this, I might feel aroused, I might not. I don't need to know why I was, because that's the whole idea. That's the compulsion people are looking for, is why was I aroused by this? It must mean something important. We don't put that importance on it.
No, exactly. Kimberly, this is a good question. I actually hear this a lot. How can I manage my fear of accidentally killing someone? Some people say hurting somebody when I am a nurse. It makes my job debilitating and I want to quit. All I want to do is help people and I can't imagine another profession. This details so well kind of what OCD does. It attacks what people absolutely value and what they care about. You care about helping other people, and so it wants to jump in and say, well, how can I screw that up for you? And it's so frustrating that happens, because like you said, you can't imagine another profession for yourself. I don't know if you have any thoughts, Stuart, on... Yeah, I agree on that point. The amount of people I've met with like pedophile-themed OCD, and they're all teachers, people that work with kids in some capacity or another, or they're like a mum who just lives for their children, so it's no wonder OCD's latched onto that. It's, as you say, it's what they care about most. You probably don't get someone who hates children that gets that theme. Maybe you do, but I haven't met them yet. So how can I manage my fear of accidentally killing someone? I mean, look, as a therapist, this comes up for me in the sense of, what happens if I say something that leads someone to commit suicide? Or what happens if I don't say enough and it's not quick enough and then they end up killing themselves anyway, A trigger warning I just talked about. But there, so that comes up for me and it's a worry. But where I'm at, I should say it's never become a full OCD theme, but I know that I see it trying to latch onto this at times. And for me, it's about remembering my values. As you say, your values is to what do you say? Help people. Same for me, it's to try and reduce suffering and make people's lives better. And that's where I focus and try and accept the possibility one day maybe I'll do something accidentally or or whatever, and it's going to cause harm, and that's scary. But I have the right training, I adhere to ethics, I do whatever, and I do my best. So but in terms of like good old ERP, gosh, or maybe scripting would be useful around trying to become not numb, desensitized to that worry. I don't know, is that
'Cause I tend
How
to
would-
find. Oh, go ahead.
I was gonna say, how would you work with this, with Kimberly's particular worry in ERP?
Sometimes I see this when it's very, very small, minor things, like I'm giving someone their meds. Maybe I mixed it up, or put an IV in somebody. What if the needle was already used? Just anything like that. That the brain will come up with threats and questions about anything. Typically, how we use that exposure and response prevention, which is what therapy we tend to use for fears like this, is how can I teach my brain to essentially trust in what I'm doing and not respond to the what ifs or fears, which seems so risky, because what if I did mess something up? But a lot of times you've probably heard me say this before, magic words are maybe, maybe not. When somebody's feeling anxious about something, I have them look around, and if I don't see immediate danger, nothing's happening, I'm willing to risk that the fear or thought I have in my mind might actually be true or false. Kind of like Stuart said, using exposures, hopefully with a therapist, to kind of help you guide yourself through that. But often we might say, trusting in what I know, everything else is uncertain. If my brain throws out any threats, and whether it's a maybe, maybe not statement, or whatever it might be.
Yeah, I agree. Kimberly just said she spends so long pulling out the medication, and I get that. I can't imagine how triggering that is, But like you said, absolutely find a good therapist that can help you specifically target therapy for these worries, and absolutely in time that shouldn't be a problem. Hopefully, it's definitely workable.
Yeah, absolutely.
Even if it sucks right now.
Yeah, and I understand it definitely feels like a risk. The brain's really good at saying, I can take a risk on contamination over here, but this is somebody's life. I can't do it with this. And we have to sometimes say, actually, all of it's the same, even though it feels different. And we're willing to use exposures with whatever theme or topic comes your way.
Yeah, absolutely.
Yeah. I've got Nicole here. I've got an old obsession about earthquakes or tsunamis. My compulsion is to check the lights to see if they are shaking. And when the OCD is bad, I think I'm shaking. Help.
Yeah.
And so easy to do that compulsion, for sure. And just like any other topic or OCD theme, or even phobia, we treat it the same. Kind of like I said earlier, without it being reassurance, we kind of like, well, I don't see the roof coming down. I don't see don't see anything happening. We also don't want that to be turned into a compulsion, but if I don't see it, I'm willing to risk it, and learn that people learn different behaviors of, if I keep looking at the light switch, what do I want to do? Do I want to keep looking at the light switch? Do I not? If not, I'm willing to risk that I don't look at it and I'm going to miss something, possibly, which feels very risky to do, but that's the whole idea of treatment, is be more uncertain about some of these fears and topics.
It's taking a calculated risk. What did someone say to me the other day? It really distinguished between safe risk and safe danger and real danger. I can't remember. Anyway, an ERP is that it feels dangerous, but generally it's kind of a safe danger, and danger is not the right word, but yeah, I think if we keep flipping the light switch to check if the lights are shaking, we're not giving our brains a chance to learn that an earthquake didn't happen tonight, or a tsunami didn't happen, at least not where I am, you know. So it's almost taking that risk to be like, do you know what, if I want to check the lights right now, let me hold off 10 minutes. And maybe the urge will go, maybe it won't, but then I'll check, and that's okay, because I set a goal and I achieved it, and maybe I then expand that time. If we do that enough, we change that cycle, you know, and break the habit. So yeah, but yeah, we're a good therapist again.
For sure.
Yeah.
I think of, I know I've used this example before, but a fire alarm that goes off. That we hear that fire alarm, and majority of the time there never is a fire. I can't say never, but majority of the time there tends to not be a fire. And you know, if alarm went off right now, you know, me and Stuart, I know we're in different locations, but I wouldn't jump up and like jump out my window as fast as I can, because I know that I've experienced over and over and over again that my alarm just keeps going off and nothing's happening. And so my body isn't going to react to it anymore, because it knows that I've experienced that over and over. And so just like Stuart said, I like that we've got to teach the brain to kind of get in that same zone, that the only way for me to know that nothing is actually happening is to not have to check, but to be willing to be uncertain and realize that like I didn't check and everything ended up being okay anyway. For the brain to have that experience over and over again.
Yeah, and I think, also, if it was a tsunami or an earthquake, what good is checking the light going to do, you know? Just I'm maybe more cognitive now, which doesn't always help, but like, if it's to give you more notice to then run to safety, okay, maybe there's utility to it, but we do these, you know, think about myself when I fly, I have an up and down relationship with flying. Sometimes it really bothers me, and I do these checks, and I'm like, and then when I get off the plane, I'm like, none of those checks would have made a blind bit of difference to my safety, you know. But they felt good. They made me feel somewhat safe, you know. And that's the nature of OCD. We do these compulsions, and often, if there was an actual thing, it wouldn't make a blind bit of difference.
For sure. Colin, can you point me in the right direction for exposures for breathing OCD? I know Stuart recently had a podcast, maybe it was 2 or 3 podcasts ago, about, I think it was about this, right? Sensory motor OCD.
It was, yeah.
And some great information in there of kind of how to treat this. I've heard many different solutions. I don't know if solution is the word, but different ways to do exposures with breathing OCD. And it kind of depends on the person, from what I found. That just like any other exposure that we might do, or the idea is not how can I not notice it, but more of how can I notice it, how can I just be aware of it and not do anything about it, essentially. Not try to fix it or have it go away, or find the solution, which I know sounds weird, but we tend to put a lot of threats to, is this going to go away? When will it go away? I'm still noticing it. That's bringing that attention to it, which will tends to just make it happen more and more and more. And
that's absolutely it. Yeah, the more we pay attention, sensory motor is a tricky one, because the more we pay attention to whatever the sensation is, or the body part or whatever, the more we notice it. And I think that goes back to like the groinal type question earlier. The more we think about arousal, the more like we notice the sensation down there, or, you know, and it's most of us haven't noticed what our left foot feels like this entire time. But now I'm feeling the left part of my ankle is quite achy, it's quite tired, you know. But I haven't noticed that up to the moment I directed my attention towards it. And now I'm probably going to keep noticing my ankle, which I am as I'm talking. The more I talk about it, the more I notice it. And how you break that is one way is trying to let go of attention. And as you mentioned, Michael Greenberg, who was on a few episodes ago, we specifically talked about somatic OCD, sensory motor OCD, and he takes a different view than traditional ERP around this stuff. But if you're interested, check the episode out. But also go to his website, Michael Greenberg, or just type in Michael Greenberg OCD. And then in his articles, he's got an article called Treating Sensory Motor OCD or something like that. Anyway, you'll see it, and just see if that makes any sense to you. If not, you can look at like the traditional approach of ERP to it.
Yeah, perfect. Thank you.
Yes.
I have real event OCD, but past events span across subjects that are relevant to other forms of OCD. Is it possible to have multiple forms of OCD, or is the real event OCD attacking many areas? I often see individuals that will have multiple themes of OCD. It's actually, I don't know if rare is the word, but when it's just one theme and that's all it's ever been, I don't see that very often. It tends to attack multiple areas, different times in people's life, where maybe I just had kids and it kind of moved over to kids, but I also have this old one as well, or I have to fly next week, and whatever it could be in somebody's life. With real event, sometimes I see a mixture between this and responsibility OCD. I feel really responsible for the things that I'm doing, and not sure if I'm doing it right, if I hurt somebody, if I did something wrong. It's taking these real events and kind of turning into that responsibility piece as well.
Yeah.
So I don't know for you specifically, what you're going through, but it's kind of my thoughts on it.
Yeah, good answer.
I'm just trying to... My reading skills are actually pretty... It takes me a while to read.
Even glasses.
Yeah, it's true. Can OCD make you feel like it's changing your opinion on said themes and thoughts? Because I feel like my mind is trying to self-justify it and make it feel like I'm starting to accept it. The first thing that comes to my mind is kind of some meta OCD. There the brain starts questioning, do I actually like what I'm thinking? Am I accepting what my therapist told me to accept these thoughts? Does that mean I actually want it? It's, as far as opinions go, we're just kind of the same people as we've always been. And somebody can shout at us all day long about something we don't really care about, and not really going to change our opinion that much, because we are just who we are. It's really tough, because it's, with OCD, we are saying don't do anything with it sometimes, and accept it and embrace it, which people have a really, really hard time with, because that must mean something different. It must mean that I really do like this thing and I don't want to like it.
Yeah, I think, and also as the thing that came to my mind is, as you go through therapy and the theme, whatever it is, starts to bother you less, that might be OCD's way of creeping back in and being like, see, it doesn't bother you anymore, therefore you like it, and you know, and that's almost OCD's last ditch attempt to try and hold on, because you've outwitted it so far, and now it's, as you said, meta, it's gone up a level to try and outsmart you. And there was one other thing that came to my mind, and I'm forgetting it. No, it will come to me maybe. Oh, that was it. Yeah, I think with OCD, people worry so much about the thoughts and that they're having, and I know sometimes it's a worry of like, but what happens if I do that thing or become that person? And I'm very much, we need to focus on what you actually do in life, you know? Yeah, you had a thought around harming someone, but have you actually done it? Do you think there's a chance you're going to do it? Probably not. And until you do it, you're, as far as we can work out, a good person, whatever that means. So I think it's putting more weight as the individual on what I'm actually doing and done, no matter what I think, because thoughts don't change the world. It's actions, like I've got some friends with horrible senses of humor, but they're really good people in their actions, and that's all that matters.
Oh yeah, I like that distinction. So, any tips on how to cope with the doom that I feel when I'm trying to accept uncertainty by using a maybe, maybe not technique? This kind of reminds me of the question we had earlier about maybe the anxiety. And that's really tough because it's easy for me to say, well, we just embrace it. Embrace that feeling. Don't try to fix it. It doesn't seem like a good solution. But we know that whatever goes up has to come down. And so what I say is, if somebody decides to use a maybe, maybe not statement, it's not just using it just to use it. It's using it with a lot of meaning and a lot of power. So I'm willing to say maybe, maybe not. And how can I follow that through to remind myself that I'm staying uncertain about this? Because if I am watching something on TV and I felt triggered and I said maybe, maybe not to a thought, and I'm just going to continue watching the movie and hopefully forget about it, it's going to feel like a lot of doom. And it didn't really do an exposure. I was kind of just being exposed. So the idea is, what can I do in that moment, which is kind of what you're asking. In that moment after I've used that statement, I say, how can I be more uncertain about this thing? How can I keep reminding myself? Sometimes people write down this statement over and over and over and over and over to really stay engaged with. You can keep throwing out these threats, but this is what I'm going to say over and over and over again, to stay really engaged with that. And when that doom feeling happens, it's like some people choose to almost celebrate it, which sounds strange. Like, yay, I'm so glad I feel this really uncomfortable feeling right now, and it can leave, it can stay, whatever, I don't care. To really not give it much value, because that doom wants to say you're in danger, and we've got to teach the brain that, like, I'm willing to sit through that and see what happens. Do an experiment almost.
Yeah, good answer. I think doom for me is it's very much like that word for me means like, well, my world's closing in, that sense of doom, everything's coming in on me, which is terrifying. And one way is kind of like, the bring it on mentality of, as you say, you're feeling that doom, bring it on, let it all crash down on me, whatever your brain's telling you, yep, great, and if that's too much, like for me, it's visualizing it like a huge wave. As I say that, I'm reminded of the question earlier, but like a fairly decent sized wave, and you've just got to hold on in your boat, and that wave will pass, and it's going to be a bit rocky, and it's going to be very scary, but then it will pass, and the sea calms again, and seeing it almost like a surfer just needing to ride out this wave. Yeah,
great answer.
Okay.
And so, well, I know it's getting late where Stuart is, so maybe we'll do just a couple more. I thought this was a good question, because this is something that I get quite often. How long does it take for the uncomfortable feelings associated with OCD to go when facing it directly? That's really hard, because we all want timelines. If I went to a medical doctor about something, I'd probably want to ask them, how long is this going to last? When will it go away? I don't know if I have a super good answer of how long something takes, but I don't know. Stuart, do you?
I think
any thoughts?
I like the unknown error put feelings and not anxiety, because as you know, OCD isn't just anxiety. That is the common feeling for most people, the driving force behind the thoughts. But others feel disgust, shame, guilt. I'm forgetting the others, but yeah, so it's absolutely feelings and not just anxiety. But how long does it take for uncomfortable fear? Yeah, it really depends. And I think it depends on how much this theme or this spike or this particular obsession has really kind of got you by its grips. You know, if it's a small one that doesn't bother you so much, it might go quicker, you know. If it's like the thing that frightens you the most, maybe it's going to take longer. And it also depends, if you're doing compulsions while you're waiting for that uncomfortable feeling to go, that's going to keep reigniting it and keeping it going. Yeah. But yeah, so how long is a piece of string, unfortunately? But it's going to fluctuate, sometimes longer, sometimes shorter.
Yeah, it really is. We try not to put a timeline too much on things, because that can cause a whole separate issue. Is like they said 6 weeks and it hasn't been it's been 6 weeks and it's still there. That we wouldn't want to go through that either. Sometimes it's setting realistic expectations about what does progress actually look like. That I might continue to still have thoughts that are uncomfortable, but my body's not responding to it anymore. And we say, well, that's just like everybody else. I might have a very interesting, intrusive thought that really bothers me, but my body doesn't respond, and so I tend to just have it come and have it go. And so sometimes setting up that really good guideline for yourself of what does progress look like for me.
Yeah, really good point. And I think also the more we kind of try and watch or observe or notice, when is the feeling still there? Has it gone? Then in a way that's a compulsion. It's checking on OCD. And what we need to do is not check so much, and also use that time to, okay, the uncomfortable feelings are there. What's important to me? What are my goals? Let me go live my life. Let me go do something meaningful to me, with or without these uncomfortable feelings. And then if you get engaged with something, you may find, oh, do you know what? I've completely forgot about whatever it was, shame, guilt, anxiety, for the last hour. And that's a huge win,
Oh, yeah.
Re-engage again. Oh, another hour, It's not as easy as that sometimes, but that's kind of the structure, I think.
Oh, yeah. I love that. It goes back to those little wins that we can find.
Yeah.
So. Okay. This one's pretty similar to the other one, but can I recover from HOCD, or sexual orientation OCD? I'm getting better at handling these thoughts, but they're still here, and I'm scared I could be in denial, so I'm losing hope. That kind of reminds me of the thing I just said like 2 minutes ago, of sometimes we might still have thoughts, but the body doesn't respond to it, and so it wants to put meaning to that stuff. And we try not to put meaning to it. We more focus on what's going to bring me joy. What values do I have in my life? What's going to help me propel myself forward and enjoy the present moment more than the what ifs that are coming in my way. I've seen people that have this theme specifically that we've worked on for quite a while, and new values come into their life, and we'll start talking about these new values, and I'll say that, well, how does this, sexual orientation OCD? And they're like, oh, I totally forgot about that. That I've seen that experience over and over and over again, where it just kind of shows the nature of OCD. It sometimes wants to popcorn over to something else, and then something else, and something else. That definitely individuals, I'm always careful with that word recover, because each person thinks about it a little bit differently. But I know that we can definitely recover, manage OCD symptoms really, really, really well, no matter the theme that comes our way.
Yeah, absolutely.
All right, let's do one more question here, if that's all right.
Yeah.
So, how do I defeat real event OCD when you believe you deserve prison, death, or some kind of punishment? Man, so common to feel all these feelings that Stuart mentioned earlier. The guilt and the shame and almost feeling like you don't deserve treatment. I don't know if you want to expound on what you talked about earlier.
Yeah. Well, first of all, on the podcast, I did an episode with Stacey Wachner. Is that a surname? I'm forgetting. But titled Real Event OCD and the OCD stories, or you'll find it. And that's quite a good episode. And she really breaks down but yeah, real event OCD is a theme that plagued me. And yeah, you feel horrible. You feel like the worst person because it's loosely based on real events, even though often those events weren't that bad, but your brain has turned it into like this horrible thing. And you were even, at least in my case, like I was evil in my intentions and blah, 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 blah. I wasn't, but like, I wasn't reassuring myself there. I was just for the audience clarifying. But it's really tough because, and again, going back to false memory, the more you go over the memory, you're just like, well, what's real? So a good therapist is where to go with this one. But I think the big thing that stands out for me when I saw this question is just the shame that I sense in this question. Like, I experienced that shame. I think this person experiences it quite heavily. The fact to think you deserve prison, death, or some kind of punishment. CFT, compassion focused therapy, can be quite good at targeting that, but a good ERP therapist should have plenty of compassion and shame beating tools anyway. Yeah. I think I listened to a podcast last night, Dr. Patricia Zarita-Ona. She's got the Playing It Safe podcast. And she did an episode with Johnny Say, who's a UK therapist. He has OCD himself, and he's a CFT, a compassion-focused therapist. And he says something that was really profound around having compassion for ourselves because we did the best we could with what we had at the time. And and I think real event is still OCD in this case. But even if someone is an outright criminal or has done bad things, they were most likely just doing the best of what they could. And, attachment theory has been a big part of my training. I try and look at from the earliest stages of someone's life as a baby and how, if they have the wrong circumstances, their brains are wired in a certain way and they make bad choices, unfortunately, but they were doing the best they could with what they had. I think that's a much more compassionate way of looking at even people in prison, versus they're just bad people, which I don't think helps anyone, them or society. They just did the best they could with what they had. But in the case of real event, obviously it's a bit different because often these events, these memories have just been massively warped by OCD and exaggerated. And if we keep reliving the memory, we get to the point where we do feel we deserve prison, death, or some kind of punishment. And so I guess one thing is just try and work on compassion for yourself, even if you feel like you don't deserve it. You do. And find a decent therapist and really work with them on this, and is absolutely treatable.
I like that. Compassion is the word that kind of stuck out for me from what you said. And whenever I hear somebody say the word deserve, it almost makes me kind of cringe a little bit. I feel like for people that I see, we don't use the word deserve. It doesn't belong in our language anymore. Because we don't deserve punishment. We don't deserve happy. We just do what we do. And if I choose to be happy, I'm going to be happy. If I choose to make different choices in my life, that's what I choose to do. And if I want to be happy, if I want to feel joy, what do I need to do to take me towards that path? That's what I focus on the most, more than past experiences. What's going on right now in my life that's going to help me propel myself forward? What can I do differently?
Yeah.
And that's what tends to make us the happiest. Something Stuart said a lot earlier is a lot of people do some compassion work before they start exposures, which sounds like would be a very good thing to do when people they feel like they deserve punishment in some way.
Yeah.
And so,
Yeah, absolutely. Everyone deserves compassion.
yeah. And so, well, it's 10 o'clock where Stuart is, 10 p.m., 4 o'clock where I'm at. And so I'm so glad to have Stuart here. I know we didn't get to everyone's questions or comments here, but if you want to, you can copy and paste the question that you have, hurry and throw it in the comments down below, because for some reason, the comments disappear for like 24 hours and then they'll come back. But I go through and I try to answer as many as I can just on the video. Nice. And for Stuart, I get the website correctly, the OCDstories.com. Those podcasts are amazing. It helped so many people that I work with who listen to them every single time and come out with such great insights. So I recommend going to go listen to that. And so I know I didn't mention this, I do have my online course that individuals choose to take. It doesn't replace therapy, but it's more how can I do treatment for myself essentially? How can I know about my own OCD and manage symptoms? It's definitely, I'll link Stuart's podcast as well as this link down below. I also recently just released the BFRB one for hair pulling and skin picking as well. It goes through the same deal, how to treat it. And so, nice. Yeah. Well, anything on your mind, Stuart, that you want to end with or say before we end?
Just thank you for all the questions, everyone, for watching and giving us your time. I really appreciate it. And Nathan, obviously to you for bringing me on. I really appreciate it.
Yeah. So I appreciate you so much. And
thank you.
Thank you very much. And maybe we'll have you on here again at some point.
Yeah. Look forward to it.
Yeah. Thank you.